Good evening. Welcome to Health Plus Weekly. I am Dr. John Podkowa. I'm joined by our co-host, nurse practitioner Hannah Raymond. And tonight we have just the two of us in the studio tonight. So we want to encourage everyone to write in with your kind of general medical questions, and kind of tonight's the show about you guys out there. We hope to answer your questions. June is also Men's Health Month, so we're going to go through in terms of kind of spurring some conversation. Current recommendations for men in terms of kind of keeping yourself well and preventing as much disease as possible. So we'll go through the United States Preventative Services Task Force of recommendations and talk about those subjects. But please feel free to write in if you have just any other questions you'd like to hear us kind of comment on, whether it was past shows, further information, or something else that's on your mind. Please let us know. Also, in terms of just some general announcements before we get started, I just want to let everyone know that this year Camp Angels will be July 14th and 15th in Asona, Massachusetts. This is a camp that Southcoast offers for children who are grieving the loss of a loved one. The ages are for children and teens ages 6 to 15, and the activities include typical summer camp activities such as swimming, arts and crafts, but they also have really focused discussions on kind of loss, and it's a great place for children to feel safe and kind of to discuss their feelings about what happened to the loved ones in their lives. For more information, you go to southcoast.org and search Camp Angel Wings. Food for Tots is back on in Fall River this Thursday, June 21st. Food for Tots is a great program where certain restaurants who participate in it, 15% of your bill goes towards Southcoast Pediatric Services. To date, I think they've raised $18,000 to support Southcoast Pediatrics. It's an amazing fundraising campaign. The restaurants this year are Scotty's Pub, Fall River Grill, Barrett's Waterfront, Barrett's Ale House, Fall River, Sagre's Restaurant, and Applebee's Bar and Grill. We want to thank Plymouth Investment Advisors for the generous donation to match the sponsors. So again, Thursday, June 21st. And finally, there's a summer fundraiser with the Tavares that will be performing, hosted by the Auxiliaries of Charlton Memorial Hospital and at St. Luke's Hospital and Toby Hospital Guild. The evening will be at White's of Westport on Friday, July 27th. Again, the Tavares will be performing on Friday, July 27th at White's of Westport, and those proceeds will benefit projects at Charlton Memorial Hospital, St. Luke's, and Toby Hospitals. You can find more about that evening with the Tavares on the southcoast.org website if you just search under Tavares. Good. And with that, Hannah?
Yeah, we also want to encourage people to tell us where they're watching from. I think the farthest person we've had so far is maybe New Hampshire, and yes. I think a family member of mine was watching from Missouri, so that's so far that's the reach. We'll see who's watching from farthest away today.
We hope everyone's having a great summer, and also like to hear about kind of summer activities and just kind of let us know what's going on. So with that, so men's health, something we see, obviously a lot of in our practice, and but maybe doesn't get as much press as people you would expect in terms of keeping us healthy. So where would you like to start?
I think just important from the primary care perspective, which we kind of come from, and I know we go heavy on that on the program, but we always think about ways to prevent disease first. So there's preventing disease, there's detecting the disease early, and then there's managing the disease and kind of everything that goes along with that. So I think maybe we could go through some of the recommendations from the United States Preventative Task Force, which sets the recommendations for the screening and kind of recommended health maintenance for different groups of people, different ages.
I think it's ironic. I saw a lot of men in the office this week, and a lot of them were accompanied by their wife, which was great because, unfortunately, men usually don't go to the doctor as much as women. There's a number of reasons. I think perhaps women live longer, but sometimes I joke with men is the fact that they go to the doctor earlier. So just kind of reminding men out there that it's important to take care of yourself. Right. And we're busy. We don't, and a lot of times if it doesn't hurt or bother us, we don't think about going. Right. So
I hear that commonly, kind of, asking why somebody comes to the office, men especially, a common reason is, oh, my wife or significant other or somebody just kind of urged me to go, which is great. So it means that, and we never mind that one bit.
No, but if there's men out there listening and you don't have a primary care doctor, you haven't seen your doctor in a while, we encourage you to just please make an appointment and check in. If there's people out there who care about a man in their lives and they haven't been to the doctors recently, to just give them a gentle nudge to get plugged in, because it can make a big difference if we catch things early.
Speaking of people who care about you, your son JJ says you're doing a great job. So,
thank you, handsome.
Hi, Grace. Hi, JJ.
Hey, guys.
We have also people watching. Laura's watching from Marion, Jean from Fall River. Dr. Rocha's watching. Hi, Dr. Rocha.
Hi, Mike.
Grace and Maria also. And hi, Margaret, too. So kind of working through the recommendations for men's health screening. Yeah. Where do you want to start? At the top, right?
Yeah, why don't we go through? So, colorectal cancer screening, we just got over kind of Colon Cancer Awareness Month, but an important cancer which is, I think, one of the best screening modalities we have to catch it. So, from any man over starting at age 50, the recommendations are to start colon cancer screening then. And when we talk about why you screen, because some people say, like, I'll wait till I have symptoms, but the reality is that you won't know until it's a more advanced form of the cancer.
So a common thing when kind of discussing a colonoscopy with patients that I hear is, I've been moving my bowels fine. I don't see any blood in it. I don't, I would know. I would know. And the point of the screening is that you wouldn't know. Like you said, there's kind of different tests aside from the colonoscopy. I'm sure people have seen the commercials for Cologuard, which is another type of test that detects for not only blood in the stool, but actual kind of chemical changes that occur with some precancerous polyps that can be present in the colon without even knowing. So that being said, also, there are some scenarios where men should be, and everyone also, should be screened earlier than age 50. And some of those are, having a first-degree relative who was diagnosed with colon cancer at a young age, or having, a family history of multiple polyps, or, certain types of polyps, and kind of other first-degree relatives with multiple cancers.
So really important to know your mother and father's history, if there is, and siblings. Also important to know, other family history, but perhaps for colon cancer screening, definitely to know mom, dad, brothers, sisters, whether or not they've been screened before, and if they have types of polyps, because it can help shape things. And I think you touched on an important point, that a lot of people don't want to do a colonoscopy, or afraid of the colonoscopy. But there are other ways. There are other ways that are not so invasive or expensive, to screen for. Because sometimes co-pays for people are expensive and not. I don't think they're as good as a colonoscopy. The reason why we love colonoscopies in terms of screening for colon cancer initially is that it's diagnostic and therapeutic, in the sense of you can look at the whole colon, identify the polyps, and then they can remove them at the same time. So you don't have to go back for a second procedure. Where the stool kits, which are great and have definitely have a role to play, if they become abnormal, you ultimately need your colonoscopy as well. So, and we're lucky at Southcoast. We have multiple locations where men can get this done, in terms of St. Luke's Hospital, Toby Hospital, and Fall River. In multiple sites, so your primary care doctor can help you get connected, or you can even just reach out onto the website and look for a gastroenterologist.
That might be a good future program, kind of walking through what a colonoscopy is. So maybe that's to come, in terms of kind of making people feel a little more at ease for the whole process, because it is so important.
While we're on cancers, we can talk about lung cancer screening, which is one of the newer recommendations for people who have a history of smoking. Over the past several years, there's been, studies have shown that, a series of low radiation CAT scans, which is just a, kind of a fancy picture of the chest, can catch lung cancer in early stages, and can be possibly, in times can be curable. So, do you want to break down a little bit who's eligible for that? Sure.
So, and again, we're talking about men today, but this does apply to women also. So people over the age of 55 to 75, who have had a 30-year smoking history, and who are not currently smoking, who have quit smoking for 15 years. And so that would be kind of if we knew that was, if you discussed that with your primary care physician or provider, and that history kind of came out, we would refer you to our lung cancer screening program that we have at Southcoast.
And then what does that mean, like a 30-pack year history? That can be just, if you've smoked, 1 pack of cigarettes for every day for 30 years, that's a 30. Or if you smoke 2 packs a day for 15 years, it kind of qualifies. But I don't think you have to even worry about it too much. But if you know a smoker, or if you are a smoker yourself, you can ask your doctor about whether or not you qualify.
Yeah, I think that's more important to kind of, we can assess your risk rather than if you bring it up. And that's why we do care about, we know that the longer that you stop smoking, the benefits are, extensive, but we do care about how long you smoked before you quit also for that exact reason. And that can be, identifying lung cancer earlier is, increases the risk of, the chance that you can treat it better.
Just surgically. Yeah, absolutely.
Surgically.
And we have a great thoracic surgery clinic in kind of like, lung cancer screening program at Southcoast that's headed by Dr. Tammy Gleason. So our patients, we refer them there, and they track them and monitor them and kind of help them schedule the exams each year and check in, which is a great resource.
So we have a question from Tiffany. How should polyps identified as sessile be addressed? Does this identifier put them at any greater risk of being malignant? I'm not sure exactly. I know that there are different types of polyps that will, require you to get a colonoscopy at 3 years or 5 years rather than the 10 years. Are you familiar exactly with the exact pathology?
And then it determines the sessile in terms of the shape of the polyp as well. So, generally, the most benevolent polyps are hyperplastic polyps, and then adenomas, and as you increase their way up. And also depending on the size of the polyp and how many there are. So it's not a simple one-size-fits-all answer, unfortunately, to that question. But I would say that is, you need a bit more detail on the number of polyps. Okay. And perhaps we can have, like you said, a gastroenterologist on to talk about number, size, shape of polyps to determine when you have your next interval.
Right, because that can be a little bit confusing too. Kind of the general rule of thumb is with a clean colonoscopy, 10 years when you repeat it, and you don't always know when you are walking out of the colonoscopy, when you should come back because that pathology, and then so they can see the number of polyps but can't quite identify yet what exactly the makeup is, and that can change after. So that would be important to kind of touch base again with whoever did the colonoscopy and kind of figure out, what is that interval that I need to come back, because it could be less than 10 years, and it would be important to know that too. And that's something that we tease through kind of on a daily basis when we see people for.
Sure, yeah.
So that's important too. A question from Jeanette: does the lung cancer screening program through Southcoast accept patients who are not seen by a primary care doctor at Southcoast?
Oh, yes. Yeah, Jeanette, great question. Absolutely. And I think you can even self-refer into that program as well. But if your primary is not within Southcoast, they can refer in as well. Absolutely.
And then a question from Laura: do men get colon cancer more than women? I believe it's higher. I'm not sure exact on the.
I have to research that and get back to you on that in terms of the prevalence. But unfortunately, there's a high prevalence of colon cancer in both men and women. Maybe while we're looking here, we can get back to you on that.
Yeah.
And then another cancer that is not so simple to talk about in terms of guidelines that affects men is prostate cancer, which there is a lot of conflicting information out there about whether or not men should be screened for it and what age should be screened for it. And so we just want to address and talk about it, that's a discussion that you should have with your doctor, because everyone's a bit different. And why do we worry? And I think, what is the concern about prostate cancer screening? And the concern is that there is perhaps, there are prostate cancers that men will be diagnosed with that will perhaps never harm them, and that they can live with them for a long period of time, and perhaps they'll die from other things. And there are other prostate cancers that are not so benevolent, and that they potentially can cause a lot of illness and pain and cause a lot of men to die. And how do we tease out which cancer men has is not so easy.
Right.
And so with that discussion, what we have with our patients is the pros and cons of screening, and whether you do that through a blood test or rectal exams and working with urologists and the procedures. And the different societies kind of just agree on that. It's a discussion to have with your doctor in terms of also how long you have to live, what other medical problems you have, how well you kind of get through the surgical process. In the future, we plan to have on one of our urology associates to talk about the procedures and what we do in terms of prostate cancer screening. But we want to address it tonight to say I think it's an important thing. We think it's an important thing that you bring up with your doctor and you talk about.
To have that discussion
Absolutely.
At least. Yeah.
Yeah.
That's great. So we do have some great questions here.
Awesome. Thank you, everyone.
From Sherry's wondering, the lung cancer screening program is only for patients over 55, and I believe it is.
Yes.
Yeah.
Yep. That's the guideline, starting at age 55.
And then a question from Holly asking about HPV cancer. Do you see this a lot now, a lot more now in men than in women? So I think. So HPV is the human papilloma virus, and that there's many different strains of the virus, but there are high-risk strains, 16, 18, and 32, that are known to cause changes in the mucosa, whether it's in the cervix for women or kind of in the you can get it kind of in your oropharyngeal tract in men or women. So we don't. Just from anecdotal experience, seeing it in men in terms of an oropharyngeal cancer, I have not seen that yet. But I do know that is a risk factor and can be identified as the cause for laryngeal cancer as well.
And as a current kind of guideline for screening, we don't routinely screen for that, although we're starting to at Southcoast. There's, like we just announced it a couple months ago in terms of oral cancer screening, looking at. We do routinely recommend our patients in terms of, kind of overall health picture, seeing a dentist, though, which is really important. Someone who looks in your mouth, dentists and oral surgeons, and do a really good job of assessing people's mouths. So it's not just about, kind of keeping your teeth white and things, but also about good dental oral health. So it's important.
So another question, let's see, Jeanette says, thank you, you're welcome. And Jamie Rogers said, just want to say I've heard a lot of great things about you, so rare nowadays, so good job, keep up the great work, Doc.
Thank you.
And I think all your patients feel the same way. Laura Lee is wondering if both of her parents passed away from lung cancer, should she get a screening with labs, etc.?
So great question. I'm sure there's a small hereditary component to lung cancer. However, if you're not a smoker, or if you don't have a significant secondhand smoke exposure history, I don't think necessarily the screening program for you. You can talk to your doctor a bit more about it. And in terms of a blood test, there's no blood test right now for identifying early stage lung cancer or screening purposes.
Right.
So.
That being said, another kind of segue into something that we screen for every day is smoking.
Yes.
Stopping smoking. And I know we've harped on it a lot. It's pretty much everything we talk about, but just the importance of we keep at you in terms of your primary care provider offering. There's different ways to assist with quitting smoking. And when you're ready to take that step, we always recommend, no matter when it is, just call and we can help you.
In terms of medications, there's the Chantix that people have heard of. There's bupropion. There's patches, and we can make it easier than just kind of going it alone. And I guess in terms of just kind of the simple stuff in prevention for men too as well. The 4 kind of habits, lifestyle habits that the Center for Disease Control have identified to causing most of the illnesses in this country, or chronic illnesses. Is smoking, number 1. So perhaps the best thing you do for yourself is to never start smoking or quitting smoking. Can't emphasize that enough. 2, excessive alcohol intake is a really important driver of a lot of disease and being linked to not only liver disease, high blood pressure, but now certain cancers as well. The kind of traditional safe number of drinks for men was about 2 drinks a day or 14 drinks a week, but that's actually being even re-examined.
Reduced,
for less than that. So,
and the same for women
as well.
Except 1 drink per day or 7 per week. But now, kind of more discussion about even less than that to prevent. There's been associations with increase in cancer risks as well as cardiovascular disease other things like that. So
Yeah.
you said
And I've
smoking.
had this conversation with my male patients, friends, colleagues, myself too. You can't just kind of build up your 14 drinks to the weekend
can't save it?
or Thursday
Oh.
night.
Oh,
No,
dear.
not ideal either there. And then the two other things, the next behaviors are being overweight or obese or worse. So whether you have a scale at home or you're coming into your doctor's office to figure out what your weight is, and being inactive. So those four things, so not smoking, limiting your alcohol intake, moving or, kind of staying active, trying to walk, 10,000 steps a day. A lot of us have phones and Fitbits and things like that measure it. Or I just tell people, even just, walking 20 to 40 minutes a day, most days of the week is a really good thing.
Great.
And, in terms of weight and waist, certainly for men, measuring your waist above your belly button is, that should be half as many inches as we are tall. Is a really good indicator of just your physical fitness. Because a lot of men have muscle on them, and they may, the scale might not be the best,
Right.
kind of reflection of their fitness. Boxers or Evander Holyfield years ago was classically obese by
right.
his BMI,
Right.
but had 4% body fat. And so when we gain weight kind of around our waist, it leads to can increase diabetes, increase of heart disease, and increase cholesterol.
Right.
So if you measure your waist, if you're 6 feet tall, 72 inches, measuring right around your belly button should be more than 36 inches.
Right.
And
speaking of moving, hot off the press, we have a message from Dr. Michael Rocha about this week's weekly wellness walk, which starts 9 a.m. Saturday morning at the entrance to the Buttonwood Park Zoo. This weekend is actually Tessa Kramer, who will be a guest speaker, a psychiatrist, and the focus will be on mental health and suicide awareness. So
Great.
Kind of wonderful combination there of getting out and kind of raising awareness for a really important topic. So that, again, that's Saturday morning, 9 a.m. at the Buttonwood Park Zoo entrance, June 16th. So that's great.
And then another topic that Dr. Rocha has been on our show and talking about in terms of health is just blood pressure screening
Right.
and monitoring. So that is something that is not so easy to know.
Another thing like colon cancer, where it's
Yeah.
asymptomatic. You may not know if you have it.
Yeah. And they just changed the the guidelines in terms of the number is a bit lower than it was historically. It used to be 140 over 90. You were high blood pressure. Now they've changed it, correct? To where 130 we start to be concerned over.
Yeah.
Yep.
So another important thing that I like to bring up with patients too is about white coat syndrome that people oftentimes will come into the office and say, oh, well, my blood pressure is always high when I'm here, and I check it at home and it's fine. And that's, I don't like to permit that as an excuse for the high blood pressure, because you think about other instances in your daily life when maybe you're feeling stressed, if you're in traffic or if you've had a tough phone call at work, when you think about the same mechanism that would cause your blood pressure to be high in the office is also occurring outside of the office too. So we know that it's more likely elevated more than the person realizes outside of the office than it is than they think it is when they're calmly sitting at home. So we do take that into account, and I think it's important that we certainly give a little bit more leeway, and there's a little bit more focus on what they call ambulatory blood pressure monitoring now, where generally the diagnosis of hypertension is made after 3 readings on separate occasions, in the hypertensive range. But now we're using more kind of at-home monitoring to kind of build that amount of data to actually make the diagnosis and make a decision to change treatment or start treatment or reduce treatment in best case scenario after you've done the walk with the doc. Yep. So I think that's important for people to know too.
Another kind of thing that can exist that you may have, you may not know, we've talked about before, but it's screening for diabetes. So men who are overweight, they recommend we're checking your blood sugar to make sure there's no signs of diabetes, because again, it's a disease that can go undetected for a significant period of time before people have symptoms, and in that time it can cause some damage. So over the age of 40, if you're overweight, to make sure that you have your blood checked for people come in for routine labs. So what do we look for when
Right.
that. So over the age of 35 for men, unless there's, we start checking cholesterol to make sure there's nothing wrong. Over the age of 40, if you're, if you're overweight or there's other risk factors, we look for diabetes. And then additionally, too, any man who's sexually active, at some point in their life, we recommend being tested for HIV to make sure.
So that's a one-time screen in adults, or if you're at higher risk, it would be a little bit more frequently. And certainly, I offer it to everybody, any age. There's no discrimination there. There's no questions asked, and so I would urge people that if you have a concern at all, just bring it up. And I think that if it's better to know. So we don't specifically. I don't always go by the guidelines for that. Just if someone has a concern, and I offer it to everybody as well.
And some people aren't sure if they've ever been screened or not. So I ask people if they've donated blood, because if you've donated blood before, it's a great one. Just donating blood is a tremendously important thing to do for our community. But two, the benefit of donating blood is that you get a whole host of screenings they're looking at before you donate the blood, which is good, including HIV. Other things, hepatitis C and hepatitis B, certain individuals, depending on, should be screened for that as well. Men born between men and women, but tonight's show about men, between 1945 and 1965.
The baby boomers.
Yeah, the baby boomers should be screened for hepatitis C. And then depending on, if you talk with your doctor, if you have other risk factors for hepatitis C, you can be screened.
And without the other risk factors, it's just a one-time screen for those people.
And then you're done.
Yep, between age 45 and 65. And luckily now we have, I think for several of your patients at least that I'm aware of, we have identified kind of hepatitis C that they did not know about. And we are able to, with the help of our wonderful infectious disease doctors, Dr. Seeley, who's in our office too, and I think Dr. Dorsky as well.
And our gastroenterologist.
Yes, and our GI doctors as well. We have effective treatments for hepatitis C now where we hadn't in the past.
Yeah, that are much more tolerable, much more effective. So
thinking about other kind of highly recommended screening for men, I know we talked about it with Dr. Pinn when he was on, but an abdominal aortic aneurysm. And is that something that somebody would know they had?
Maybe. But maybe not. So
in the early stages.
So the aorta is the biggest blood vessel in our body, kind of comes off our heart and feeds our main body. And in our abdomen, it goes from our chest down, through our belly into our pelvis. It can swell and enlarge, and that's what an aneurysm means. It's a term that we hear a lot, but aneurysm means just an enlargement of a blood vessel, and it can burst. And if it bursts, it's catastrophic because there's so much blood in it. And certain people are a little bit higher risk for this, and unfortunately it's men, and specifically men who have a smoking history. So the good news is, it's pretty easy to detect.
So it's between men between the ages of 65 and 75 years old can get a one-time just ultrasound of the abdominal aorta, and that serves as the screening. And from that information, we can gauge the actual size of the aorta and if there is any kind of widening of it concerning for, the concern is that as it widens, the walls weaken and it becomes more likely that it will rupture. And oftentimes it's just, if it is a bit dilated, then we just watch it, or we'll send to a cardiology or one of our vascular surgeons, or just continue to watch it, with periodic.
Yeah, which is nice. And again, all ultrasound is very similar to, I joke around with my male patients, like in terms of you're not going to find out whether you're having a boy or a girl. You're just going to find out whether you have an
aneurysm or not.
Yeah, they put some jelly on your belly and they rub it around, and it's a really safe, inexpensive test that can provide a lot of valuable information. For our patients, and we have, again, like you said, like a host of people who can help with it, because if it is found, they can sometimes just put a stent in it, which is not even a major surgery anymore, or if it's more advanced, they can fix it, but some signs and symptoms that people may have something going on is back pain, back and belly pain that's not going away, should be, kind of investigated.
So we talked about we touched a little bit on depression as well, kind of mood disorders, just with Dr. Rocha, the walk this weekend. But that's another important thing that, we may not do as good a job of in primary care, just with the taboo of kind of depression and anxiety, but we're trying to be better about it.
I think, hugely important topic. Obviously, with the unfortunate, deaths of several kind of, popular
Higher
people
profile,
in the, in our world today, that it gains attention, that it is, suicide, depression is on the rise in our communities, and identifying it. So, all people, but we're talking about men tonight, sometimes aren't comfortable feeling it, may not know they even have it, because they may not classically feel depressed, but they have loss of interest in things they used to enjoy. They don't want to go out with their friends anymore, hobbies they like to do, they just don't, feel like doing, or even knowing where to begin. So, coming to our doctors, one of the things I'm really proud of that we started doing at our our office and throughout Southcoast is a simple screening tool that we ask patients while they're waiting, or we go through when they check in, which is pretty good at identifying depression. It's not perfect, but it's a great conversation starter in terms of something's going on. Because several times I've used it like maybe something else I want to talk about, but then you look at it and someone may their mood has been off or struggling, and perhaps that's more important to talk about that day.
Right. And it also serves as a comparison. Because you can certainly, and we understand this too, you can be having a bad month or a bad day or a bad week, and it kind of reflects on that. But at least it starts the conversation, and it can give us some place to kind of go towards. So that actually consists of several questions. Are you having little interest or pleasure in doing things that you once did? Are you feeling down, depressed, or hopeless? So this is a big one too. Trouble falling asleep or staying asleep. So you think about classically depression, sleeping too much, but it's also not sleeping enough, or not able to get to sleep. And then this is one of my favorite things to tease out: feeling tired or having little energy, which can be such a wide range of causes from that. But we always have to think about depression and mood disorders as a part of that. Poor appetite or overeating as well, and then feeling bad about yourself, and a lot of times trouble concentrating as well.
And feelings of guilt and tearfulness is pretty common with it as well. And
then people, a lot of times what I'll hear is that, my sister told me that I don't look right, and I'm acting differently. And so when loved ones or people who know you well are commenting kind of on a change in mood, that would be certainly something to bring to our attention as well. And then, of course, any thoughts of hurting yourself.
Or suicide.
Suicide is important. And we're lucky now with the new Southcoast Behavioral Health Center in Dartmouth, where it's an inpatient center where, if you're really in a crisis, we have a place for you to go.
And we work with a number of great counselors and psychiatrists in the area to help people kind of connect people with the help they need.
Right. That's great. So something that I don't think also gets a lot of press is kind of talking about falls, and this would maybe be for older men. So people over the age of 65, kind of living independently on their own. How many times have you fallen in the last month? And because it certainly increases the risk for secondary injuries there. And there's things that we can do to help with that too. It doesn't automatically mean that someone's being taken from their home and kind of placed in an assisted living. But physical therapy can be extremely helpful with balance, occupational therapy, and then assistive devices as well in terms of canes and walkers, and just even a home assessment.
Look and make sure there's good lighting, throw rugs. There's a host of things as we get older that falls can be, like you said, catastrophic. Especially with some combinations with medications as well. And there are some, we have the community nurses and other kind of elder services available in the community that we could certainly send out for a home evaluation, and that would be something to bring up. So. Vaccines, kind of moving on to our next category in prevention.
We do have one question before we move on. So Laura's wondering, speaking about wives going to appointments with their husbands, what would you have a recommendation for how a wife or any loved one really would get her husband to go to the primary for his depression? Is there a conversation that you could think would have?
It's a great question, and I saw it a lot this week, and I see it a lot of times in terms of, just coming in, and sometimes spouses will come in with, their loved ones, and just in the beginning, and just kind of They talk about things that they're concerned about or want to make sure, because we forget sometimes. We get nervous, especially if you don't go to the doctors that often, you're not there, you say everything's fine, and then you realize things perhaps aren't fine. So actually, sometimes I think it's really great to bring your loved one in, significant other, to either remind you or have a list, or just to be kind of supportive in bringing up things. And then depending on the relationship, sometimes people say, I am worried about he's not sleeping as well, he's doesn't feel like doing as much. It could be in kind of starting that conversation, because unfortunately, certainly with depression and certainly with men, it's a hard topic to bring up there. I think they're less likely, or they feel a bit more reluctant to bring it up more if their knee was hurting or their back was hurting. Right. The fact is, though, it's a disease, just as like arthritis is a disease, or heart disease is a disease. And we try, certainly to validate that for people, that this is not some sort of character flaw, this is not, weakness, this is not, this is a real disease that can fundamentally infect your life and people you care about as well. And we can make you feel better, too. Yeah, and there's actually tremendously good therapy, depending on, from, talks and counseling to exercise, and if we need medication, so. Yeah, so interesting that, exercise being shown to be almost as effective in, mood lifting as some of the medications that we use. It was Laura who asked the question, you said? Yes. So Laura. One of the things, too, is highlighting to people, other people's perspective of how your loved one's feeling. They may not notice, but you're like, you haven't played with the children, or you haven't gone out with any of our friends, and people, you know what I mean, or you don't, and just how what they're going through is affecting other people around them, because sometimes they don't realize that when they're in the midst, unfortunately, of feeling depression, you kind of be a bit isolating. Right. So keep working at it. Jeanette was wondering if we can get Dr. Stebbins on the show. So we'll cardiologist, absolutely. You call him up and ask him, and we'll go on our end too. Yep. So you had started to talk about kind of transitioning a little bit into talking about vaccines. Yeah. So there are several vaccines that we kind of are on the lookout for in terms of prevention. The first ones are, or I guess starting with age, the first one we would recommend is the shingles vaccine. So the older shingles vaccine was starting at age 60. There's actually a newer shingles vaccine that is available for younger people. I think the age is 50 that it can start at, and so it's a 2-vaccine series. Yeah, Shingrix is the name of it, and it's markedly better than what was out there before. So shingles is if you've ever had or been exposed to the chickenpox virus, it doesn't leave your system. In the adult version of this, or you can get it, it's called shingles. And if you've had it, you've known it. Yeah, it can be painful. Not only can it be painful when you have it, it can leave you with pain. So people typically don't pass away from shingles. It's not typically a life-threatening illness, but it can make you really uncomfortable. And the vaccine that's out now is kind of a recombinant, or not a live virus, so there's not a chance of getting shingles from the vaccine. It reduces the risk of shingles by over 90%, nearly 100% of getting it, and the pain from shingles as well. So it's really effective. It's a 2-shot series now. Correct. Yep. And it's recommended by the CDC and the major immunization kind of practice guidelines. And even if you've had the old shingles vaccine, or even if you're not sure whether you've had chickenpox or not, it's recommended you get it. Yeah. Yep. So that's starting between age 50 and 60. Certainly at 60, definitely. Definitely at 60. And whether or not at 50, yes, as well. Right. And the other 2 vaccines that we like people to have are the pneumonia vaccines. So there's 2 of those. If you and that's starting at age 65, unless you have a chronic lung disease such as asthma or COPD, and sometimes heart disease as well. So if you have gotten neither of the pneumonia vaccines, the first one that we recommend is Prevnar 13, and so that's protects against 13 of the most kind of virulent strains of streptococcal pneumonia that can cause pneumonia. And the second vaccine is the Pneumovax, which protects against 23 strains. So people often ask, does this mean I'm not going to get pneumonia? Unfortunately, no. And unfortunately, no, but it does, provide some protection there. And for younger people, younger men with the chronic lung diseases and heart disease, and if you're a smoker as well. And and also if you've lost your spleen, which is a topic show, but for whatever reason you had an accident when you were younger, or something happened to your spleen, or some people just for a variety of you need certain vaccines you should ask your doctor about. Influenza vaccine we
Influenza,
recommend
yeah.
every fall, October to November. For men, there's certainly tetanus vaccines. The pertussis vaccine is recommended every 10 years, which we can get.
Pertussis is whooping cough is the common name, and in adults and people without chronic lung disease, we may just have kind of a long-standing cough from it, and you may not get really ill. But what it does do is, protects the younger children, the infants who are not able to get the vaccine yet from getting whooping cough, pertussis, which can be catastrophic for them. So again,
and kind of talking a lot about older, or kind of middle-aged, myself and older men in terms of the recommendations. I see a lot of young men, in the practice, and I was just looking at this data. Unfortunately, it's increasing, but the leading cause of the death of young men, young people in general, but we're talking about men tonight, is actually some sort of accident. So, to talk about safety, drinking, drugs, driving, seatbelts, getting enough sleep, because it's really, really important for young people just to be cautious. And because accidents are leading cause of death, there's a lot with opiate abuse, there's some with depression as well, but just emphasizing and just raising their awareness that, believe it or not, we're not immortal. To really be, to really be careful in terms of, company kept. I really do stress the importance of driving, making sure speed limits, and and just balancing.
I've added no texting while driving to my spiel.
Yeah, absolutely.
So I think that's really important too.
Yeah.
Yeah. So I think we've I think one thing that we haven't talked about is, and this is again shifting gears, just kind of going through rapid fire, in terms of prevention. Aspirin for primary prevention of cardiovascular disease. So this is in people who have not had a heart attack, have not had a stroke. A low-dose aspirin every day. It tends to go in and out of style or kind of favor, but the current recommendations are back in.
Depending what your risk of having a heart diseases or cardiovascular diseases, which your doctor can help you with, and those things like go into factor in terms of your blood pressure, your age, and what your cholesterol is. If you're above a certain risk, we recommend a low-dose aspirin, an 81 milligram aspirin, and it can lower the risk of stroke and heart. And there's also some good data that may reduce certain cancers as well, colon cancer. And maybe some other cancers. So certainly over
the age of 50 to 60, certainly with those risk factors, and even older than that as well. And then there's certain people who we know should be on an aspirin unless it's contraindicated, and those are people who have had a stroke, have had a heart attack, and who have diabetes as well. And then also on that same token, the use of a statin medication, so a cholesterol-lowering medication as primary prevention. So again, you haven't developed the disease yet, but we're trying to prevent it. You haven't had a heart attack, you haven't had a stroke, and that would be adult men, age 45 and up. Kind of the upper limit is a little bit of debate, but maybe 75. With no known heart disease, but one or more risk factors, and those are again things that you can discuss with your doctor there.
One of the things we recommend for our patients too is in terms of skin cancer screening. It's not
a hard and fast.
Kind of like recommendation, but just kind of a bit of common sense, and also just looking through whether especially there's a family history of skin cancer, but also skin exposure. Generally. We have several great dermatologists within our communities that we refer to, depending on their age, looking at and talking to the primary care doctor when it's the right time to see your dermatologist to go through for a body scan, because they do a really good job of not just using their eyes, they have special kind of like lights that they look at our skin through.
Magnifying
and
devices as well.
Yep.
And some of those kind of benign lesions that kind of look like cornflakes on the skin, or actinic keratosis, we call them, that you tend to develop as you get older, and I've heard a lot of people, comment, my mother had them, they had them. They can actually be kind of an early form of cancer as well. So I do recommend that, even if you develop them and everyone in your family had them, that you do get a skin check there, especially by a specialized set of eyes for that as well. And also sunscreen. Sunscreen for everybody, broad spectrum to block the UVA and UVB rays.
I think we're pretty caught up from a prevention standpoint. I was thinking we could talk about some common things that men present to us, to kind of, talk about.
Sure.
One is, I think, like, male pattern baldness, very common, so I could be a model for this in terms of receding hairline and hair loss at the top of your head. A lot of men come in terms of are worried about that. And things we can do about it. One, we just usually make sure there's not, a hormone or a thyroid deficiency associated with it, so some blood work, but a lot of times there's not. But in terms
sometimes
of
an iron deficiency can cause hair loss as well.
Sometimes iron deficiency can do it, stress and certain like vitamin deficiencies.
And some medications kind of lower on the list, but we have come across them.
Yeah. So getting teased out because something could be causing it. But then if it's just the traditional male pattern baldness, there's some great, there are treatment available, and so there's, topical therapy like Rogaine you see on television. You actually can buy at your regular over-the-counter pharmacy, which is really effective, some of the gels. There's some pills that we use in terms of conjunction with our dermatologists who are pretty effective, and also kind of getting men into kind of plugged in with the dermatologist. They need kind of other treatment options. Certainly, I think, we were talking about high blood pressure before, an erectile dysfunction is, something that is
a big concern.
A big concern for men come in, really hard to talk about sometimes for some men, some men not so much. We try to hopefully bring it up regarding just like their, when you're asking questions about their health, because it's an important part of our life. And the good news there is that, again, there's some great medications and options for to help men, if they're having erectile trouble.
Yep, and we work closely with the urologists, and we're lucky enough to have them kind of adjacent to us in our office, so they're extremely helpful. But if you don't want to talk about it with us, you can certainly request a referral, and they're wonderful and can kind of go through all of the options for treatment there. But like you said, doesn't get enough attention, and we try to bring it up as much as possible.
Viagra actually just went generic, so so it was pretty cost prohibitive for a lot of men in terms of the insurance plans and what they would cover. But there's so Viagra's generic now, which is cheaper and makes it more available. And there's also some other good programs to get some of the medications. The three major ones are Viagra, Cialis, and Levitra. You may not have seen commercials for them, and they're effective. But even if they are not, there's other kind of methods we can do to help men.
That's good. We do have a question, just kind of a follow-up from the shingles, asking, should everybody get the vaccine? Should everyone get the shingles vaccine?
So I would say men and women over, definitely over the age of 60, we recommend it uniformly, especially the new one. Previously, it was if your immune system wasn't strong enough, you shouldn't receive it. You can talk to your doctor. I'm sure there are some exceptions with allergies and things, but uniformly, we recommend it.
Right.
Yeah.
And Jan is asking, how important is supplementing CoQ10, that's coenzyme Q10, while being on statins?
Great question, Jan. I think, I have people who take statins and don't take CoQ10, and then, but a number of people do with it. It's one of my recommended supplements in terms of, I think it's a good supplement. So I think it's fine to take it with it.
Okay, great. What are some other complaints? I get a lot of requests for testing testosterone levels as well, and that kind of goes hand in hand with, the erectile dysfunction discussion. And that's something that we would do kind of first thing in the morning to get a value, and then if it was low, there's certainly treatments for that. And some of the symptoms would be, kind of fatigue, muscle loss, kind of, fat gain, and
lack of sex drive.
Lack of sexual drive, as well as erectile dysfunction.
A lot of questions about how do I keep my testosterone up a lot, right? And there's a lot of good news there in terms of, number one, like, it sounds like beating a drum, but like exercise staying, kind of thin, actually weight around your abdomen lowers testosterone levels. Using your muscles, kind of lifting weights, raises testosterone levels. And we definitely kind of talk a lot of men out of like kind of these over-the-counter supplements because they can be expensive with not a lot of benefit.
And they can be harmful too, as well. And again, if it is truly low, we work again with our urologists and endocrinologists as well to supplement that, and men can feel better, really.
Fatigue we see a lot. Men and women, but there's a lot of men who are tired. I just can't get going anymore. Want to take a nap midday. just down. We've talked about it on the show, it's been a little while, but evaluating for sleep apnea, snoring, are you snoring, are you sleeping well, do you stop breathing when you're sleeping? Such a really kind of important disease to identify for quality of life, overall health, and also it's really easy, home sleep studies, and the treatments available. I see that a lot.
I had a great conversation today kind of thinking back to both high blood pressure and colon cancer screening. I said, do you snore? And the gentleman said, yes. And I said, well, you could, sleep, when the whole sleep apnea, I said, you could be stopping breathing while you sleep. He said, well, I would know that. So again, another thing that you may not know, and the benefits that we see after people who were undiagnosed with sleep apnea and start getting treated, how much better they feel can be just wonderful. And not to mention the cardiac benefits, and just for your whole cardiovascular system.
I think you're coming into talking about cardiac, looking for and kind of having a high level of suspicion for heart disease, leading cause of death. In the United States, I think second leading cause of death in Massachusetts now, but really getting a good detailed history. Do you get short of breath more often than you used to? People don't realize that being short of breath is the second most common cause of heart disease. Are you getting some, cardiac symptoms, which could be a little bit of chest pain, could be a little bit of arm pain while you're exerting yourself? You're having funny heartbeats while you're laying down at night, kind of teasing those things out. We routinely, not always, but can do you start with an EKG or refer you for a stress test. There's a lot of men who are worried about that.
And certainly people who we worry a little bit more about are diabetics as well, where those symptoms might not be as classic. And then, of course, your family history is important too. We do have a little bit higher suspicion for men who've had, a relative with early heart disease, and kind of an early heart attacks, or anybody with family history of sudden cardiac death, which is just kind of dropping dead from a heart attack.
Of course, it's not just again to men, but a lot of men with low back pain. A lot of people coming in with low back pain in terms of identifying, what's causing it. How can we get you feeling better? Is it a disc disease? Is it a pulled muscle? And simple tests we can do right in the office when we examine you, based on, and also kind of listening to your symptoms and combining it with other kind of risk factors you may not have to get you on a better treatment path, whether it's off to physical therapy, whether you need an MRI or not, whether you need to see our neurosurgeons, most often not. But
not right away.
Not right away. Yeah, absolutely. But in terms of protecting your back, keeping your core strong, again, staying lean, core strength, is super important for protecting your back.
I think that's another future show now that we're in the new studio, is that we'll have Joe and Kathy back from Occupational Health to demonstrate some good body mechanics and core strengthening, so we can help people to prevent low back pain.
Yep.
So we are all caught up on questions so far.
Good. You gonna say something?
No, I was going to ask if you had any other thoughts on men's health as a man. Any other pearls for
I once read that sometimes finding a doctor around your own age is a good thing to do, because you'll be going through the same symptoms and problems together. I happen to see a bunch of guys today who are around my age in their mid-40s, and it was funny kind of lamenting on certain things we're experiencing in our life, which is great. Again, I love taking care of all my patients, but in terms of men, just because I think help making them feel more comfortable coming in, kind of creating a bit of a bond, because it's, I'm no exception. My primary care doctor let me walk out of his office 2 years ago, and I haven't been back. I've missed my appointment, so it's not, it's I need to get better at it ourselves. So if Dr. Chesney's watching, I promise I'll be back in this summer. I'm due. But no, I think that's it. But just for the men who are listening, or if there's men that you care about in your life, that it's really important. I think that kind of we stay plugged in, and we get them plugged in with the doctors to kind of keep them healthy.
And it's our job to have the uncomfortable and kind of more difficult conversations, and that's what we're good at. And so if you feel like you can't bring something up, just find a way if you can, and we're sure to accept it and kind of help you with it. That's what we love to do every day.
Yeah.
So.
Great. Any questions in the queue?
No, we're all caught up.
Awesome.
Good.
Well, thank you very much, everyone, for tuning in tonight.
I just want to reiterate the weekly wellness walk through the New Bedford Wellness Initiative. It'll be this Saturday, 9 a.m., Buttonwood Park Zoo at the entrance. And it will be dedicated to suicide awareness and mental health, and there'll be a guest speaker, Dr. Tessa Kramer, and there'll be other resources on the National Suicide Prevention Lifeline resources as well. So that's a great event. Thank you, Dr. Rocha, for sharing that with us tonight.
Awesome. Just again, kind of touching on the announcements we made earlier in the show. If you missed them, Camp Angel Wings will be July 14th and 15th in Asona, Massachusetts. It's for children ages 6 to 15 who have lost a loved one. So classic summer activities, but also in addition to that, some great discussion groups to help them kind of process their loss. You can find information on that on our website at southcoast.org and search for Angel Wings. Food for Tots, again, Thursday, June 21st in Fall River. 15% of your bill goes to supporting the South Coast Pediatric Services. The restaurants are Scotty's Pub and Fall River Grill, Barrett's Waterfront, Barrett's Ale House, Fall River, Sagri's Restaurant, and Applebee's Grill and Bar. And also we want to thank Plymouth Investment Advisors for their generous donation in matching the sponsorship. And lastly, there'll be a concert by the famous Tavares this summer, Friday, July 27th. All proceeds will benefit the Charlton Memorial, St. Luke's, and Toby Hospitals. That'll be on our website as well. You can search under the Tavares. Thank you for everyone for the engaging show and writing in lots of questions tonight. It really makes for a much more interesting show, so thank you for that. Thank you for the continued interest. Please pass it along, share it, and just tell people about it so we can get even more engagement.
And
next week, right?
We'll be talking about emergency medicine, how to stay out of the emergency room in the summer, and kind of highlighting some of the great new programs that they have.
We'll have Dr. Jennifer Pope,
Yep.
who's the medical director of the St. Luke's Emergency Department, who is just a rock star, and to work with, and two of her
yes, Michelle
colleagues.
and Lori will be coming on as well.
Yeah, and all the improvements they've made in the St. Luke's ER. So, Josh, thank you very much for a great
Josh.
show. Hannah, thank you very much.
Thank you.
Stay healthy, South Coast. We'll see you next week.
I started dancing at age 3, and I kept on dancing. I never stopped doing things. I liked to travel. I was walking in Iceland, and it was very painful. Not only are you in pain, but it's the fact that, oh, I don't think I better do this. I could create something that's worse than I have right now. And I really thought, I hope someone will listen to me. And that, I think, is the most important thing. And I was asked, what would you like to be able to do? And I said, I want to be able to do everything. I want to be me. I want to be able to walk. I want to be able to climb. I want to be able to dance. And I want to be able to feel secure. South Coast listened to me. I felt that it was my decision. I was in control of the situation. I felt a lot better about it. After the procedure, you feel liberated. You feel like you are your own person again. It's a wonderful, wonderful feeling. I've had good care. I've had people to answer all my questions. I feel secure. I've had surgery up in Boston at one point in my life. The care that I received here was far superior, and I just felt like I was home. I'm walking with a brand new hip, and it's doing very well, and I feel good. I'm back to where I want to be. There doesn't feel like I have anything that I can't do. When I was at the Jazz Fest and I heard the music and I started and I thought, you know what? I'm dancing again.
I became a fisherman. I used to scuba dive for quahogs, and that was heavy work. When you're self-employed, you gotta keep going. I kept hurting my back. Then I found out I have degenerative disc disease. I deteriorated to the point that I couldn't stand up. The pain was just so severe. It affected me emotionally, psychologically and physically. I had probably 12 surgeries, and I wanted to give up. The pain was just so bad. When there's no relief in sight, what else do you have? My general physician, I went to him, I told him I wanted to go to Boston, and he said to me, before you go to Boston, I know a guy at Southcoast Health. So we met with the neurosurgeon at Southcoast Health, and he told me what he was going to do. That's when I started to get happy. The pain had subsided. I wake up happy. I go to bed happy. I can stand up. I saw my surgeon 6 weeks ago. He says, Bruce, you're doing well. And I said to him, you saved my life. And without you, I don't know what I would have done or where I would be today. Yeah, there's a lot of tears, even on his part. I can't tell you how much of a difference it's made in my life. It's totally different. Now, bring it on. Life is good.